I am Dr. Xylina, for those of you who do not know, chair of the Department of Pediatrics, and more important for this purpose, I'm also chief of neonatology at Nashville General Hospital. And I have been here for the last 20 years and is so happy to look forward to us increasing the services that we have been providing for this community for, if I remember, close to 150 years is coming up on the anniversary of Nashville General Hospital serving this particular community, and had done it extremely well. Now, we're talking specifically about infant mortality, and infant mortality, as you know, is death in the first year of life, and 2/3 of that death of children occur in the first month of life. They occur among our neonates, and one of the most common causes of that is, of course, prematurity. Most of you realize, or one of the reasons we're having this is related to the fact that we just received the March of Dimes report rating us in terms of our care that we're providing to our children and our infants. And as you know, or don't know, we have been rated D+. Now, that is an increase over last year when we were rated D. So in terms of a country as a whole, we're actually still rated D. Now, when you compare the infant mortality rate in the US to that in other countries, developed countries, we have the highest infant mortality rate. So Canada, our neighbor, we are around 6.5. Canada has, and our goal, by the way, for 2030 is to get down to 5 per thousand. And at this particular point, for example, Canada, who is to our north, is at less around 4%. And then the rest of the world, it goes down from there to Japan, for example, is only, to give you a frame of reference, 1.7 per thousand. What are the major causes of infant mortality? The major causes of infant mortality, the 4 major causes of infant mortality have been discussed already. They are actually going to be those initiatives that our new chair of the Department of OBGYN has specifically brought up that we're going to be working on. One of those, for example, is congenital anomalies. And you say, well, what can you do about congenital anomalies? Well, what you can do about congenital anomalies is have access to prenatal care, because those patients with no prenatal care have some of the highest infant mortality, and many of those may be preventable. We talked about improving prenatal care, helping women and mothers who are pregnant to understand what are some of the drivers of congenital anomalies. Something as simple as knowing that alcohol usage during pregnancy can be associated with congenital anomalies. Other drug uses during pregnancy can be associated with congenital anomalies. Using drugs that are not, can be teratogenic, also associated. So prenatal care is not magic. Prenatal care treats treatable disease. It educates patients and hopefully improves outcome. The second most common cause is going to be prematurity. And most of our efforts, a lot of our efforts in terms of prevention are related to preventing prematurity. Prematurity rate in Tennessee is about twice the prematurity rate among other states. We're around 11% in this. And the other thing to remember, which is even more important, the prematurity rate among African Americans is 1.5 times greater than that. That is a consistent finding. In fact, the reason we went up in our ratings from D to D plus is because there was a slight decrease from 10.9 to 10.6 in terms of the incidence of prematurity, okay? And in this particular case, I want to point out specifically one initiative that we at Meharry and Nashville General Hospital are part of, and that's the Nashville Strong Babies. Nashville Strong Babies is an infant mortality reduction project that is funded by the federal government and the Department of Public Health in Davidson County. And Dr. White Etheridge, who is in the audience, is the one who's responsible for that component of the program that deals with medical care. And it primarily focuses on education, outreach to pregnant women and their infants in the first year of life. The other one to remember is number 3, which is important and was also spoken to. sudden unexpected infant death. And of those, SIDS is one of the major ones. But we know, for example, that infants whose mothers are breastfeed have a lower incidence of sudden infant death than do mothers who do not breastfeed. And so something as simple, it sounds very simple, as initiatives that focus on things such as improving breastfeeding, that markedly contributes to our ability to decrease the prematurity rate, or specifically sudden infant death syndrome rate that we have in this state, this city. Anyway, thank you very much for your time. I'm looking forward to our initiatives as we go out into the community and as we increase the availability of services at Nashville General Hospital. And we're looking forward to working with all of you as well as in the community as we go forward with this efforts to decrease the infant mortality and increase and improve the overall lives of our children in this community. Thank you.